If you have a question, you can put it into the question and answer. You can also put it into the chat. Emma will kindly be monitoring both, but it might be a little simpler if everybody could put their questions into the Q&A. Well, let's begin. I'm Eileen Sandberg from the Federation for Children with Special Needs. I am program coordinator for the Pathways for Parents program, and I also support the Recruitment Training and Support Center for Special Education Surrogate Parents. And we are delighted today to have our first collaborative seminar in a while with the Massachusetts Advocates for Children, and to welcome Janine Solomon, who is Managing Attorney and Senior Project Director for Massachusetts Advocates for Children, or MAC. And we work on very similar tracks and projects in supporting the special education community. And we thought if we collaborated on this back to school webinar, it would be a way for us to reach the broad audience with our messages about how to get ready for school reopening. So we are delighted to have you here today. Janine, would you like to add anything?
No, I'm just equally happy to be here and welcome everyone. Thank you so much, Eileen. And we really are excited about this collaboration. We'll say at the end, there are several other presentations coming up later this fall between our organizations, so that's exciting, and we're just really excited to present this information to you all because it's timely, and we'll get started.
Okay, great, thank you. Let's get started. What we'd like to talk about today are things that are very much related to students going back to school in just a few weeks. The Department of Elementary and Secondary Education had issued guidance at the end of July on school reopening. We're going to talk about that, about how one would implement the educational services in the home or hospital, which was recently revised with a Q&A, and the physician's affirmation forms related to that for students who are not able to go to in-person school. We'll talk about DESE's most recent guidance on promoting student engagement, learning, well-being, which came out on August the 5th, and give you team meeting information for both parents and educational decision makers, because of course our audience in this webinar has both parents and other educational decision makers like special education surrogate parents, grandparents, kinship caregivers, and we want everyone to have this information on COVID compensatory services, on requesting evaluations, and how to get the whole process going once we get back into in-person school. DESE's guidance on reopening is very, very clear and has the force of regulation. So it is required of all districts that all districts and schools will be in person full-time 5 days per week in September. We know that parents and educational decision makers can no longer choose between models of learning that include remote learning as we did in the last year. But in exceptional cases that we will talk about in some detail, remote learning may continue to be an option for a few students. It may be appropriate for students who have medical conditions who need their educational services at home or in the hospital setting, students who are already attending district in-district virtual schools, or students attending approved out-of-district virtual programs.
If I may, Eileen, just on this particular slide, just a few things related to those students that may need to be learning remotely. Some of the factors that have gone into that consideration and what's going to contribute to a student's participation in remote learning. Many of those same factors still stand as they did before about a student's access to necessary technology, devices and internet for them to be able to fully participate, whether the student and family may need some technical support in terms of accessing any apps or software, issues with troubleshooting, et cetera, whether the student has an appropriate space for learning. We know many of the students that are either homeless or in congregate care settings. We know that this was a pretty big issue, or students that are doubled up. It was a really big issue when everybody was remote before. And then lastly, whether there's any particular accommodations that a student may need due to a disability. I think we'll get into also as we get into the additional slides, but Eileen and I were just saying, just yesterday, I think the latest that has come out, and I've been watching almost every hour to see if there are any other updates, but Governor Baker did still stand. Things are still status quo in terms of the consideration. He is not considering at this point any new mask guidance. It is, as Eileen had said, in person, full-time, 5 days a week. And in the next slide, we will go into some of the masking requirements. But at this point, things have been status quo, and I'm sure we will, again, we'll have more to present on this, and I'm sure we'll take questions from you all.
And it could change by the time we're done with this webinar. So we just don't know. So we're presenting what we have today, and we will keep you updated in future webinars. Okay, so let's talk a little bit about masks. The Department of Elementary and Secondary Education and the Department of Public Health strongly recommend that all students in kindergarten through grade 6 wear their masks indoors, except, of course, for students who cannot do so due to medical conditions or behavioral needs. They also strongly recommend unvaccinated staff in all grades, unvaccinated students in grade 7 and above, and unvaccinated visitors wear masks indoors. They recommend that schools allow vaccinated students to remain unmasked. This is somewhat different from what has been recommended by the Centers for Disease Control and the American Academy of Pediatrics, which both recommended universal indoor masking for all students aged 2 and older, as well as staffs, teachers, and visitors, regardless of their vaccination status. And the last point hasn't changed. By a federal public health order, all students and staff are required to wear their masks on school buses at all times.
And you know, again, to add to what Eileen is saying, the governor has really made this, in terms of the state, it's really the local school districts, he has said, that are best equipped to make decisions about mask mandates in their districts. So we realize that some school districts have already started to come out with their own mandates. We were saying before that perhaps, I believe, Salem may have, and Boston. And also just said too, in terms of some of the other protocols for masking, there are the protocols on the buses, as well as masks must be worn in the school health offices as well. So this is something that is changing. And as Governor Baker said in his press conference yesterday, he said this is his current decision and it's as of this time. So we know that even since many of these recent guidances have come out, there have been changes, and we anticipate there will be changes again before school starts. Both the Federation and MAC always post a lot of these recent developments on our websites, and this whole presentation will be available to people, and Eileen has embedded many of the guidances directly in links for you all, so they'll be easy to find once you have the PowerPoint presentation, which we'll share with everybody.
Yes, thank you. Yes, and I think that when the guidance was issued a couple of weeks ago now on masks, we were not universally in the substantial or high risk zones, according to the CDC's classification for COVID-19. And we are now, the entire state of Massachusetts is in either substantial or high risk. So it seems that things are evolving very rapidly, and we will, I would imagine, see updates to this as we get closer to the openings of schools. Okay. In terms of other recommendations, districts and schools are highly encouraged to have a plan or to implement the plan they've already got for COVID-19 testing in the schools, including both diagnostic testing in the case of students who may be symptomatic and screening or pool testing for students and staff. DESE and EOHHS, which is the Executive Office of Health and Human Services, will continue to offer these services to districts at no cost. It's the BinaxNOW Now test that is being offered, and it's a very rapid test. It gives a result within 15 minutes. They also just released a new version of protocols to responding to COVID-19 scenarios a few days ago. And they gave examples of different scenarios regarding testing, pool testing. They have proposed a strategy, a new strategy called Test and Stay, in lieu of requiring people who have been a close contact to a COVID-19 case. They were previously required to quarantine. If they are asymptomatic now, they can opt into what is called a Test and Stay protocol, where they have daily testing with the BinaxNOW Now test for at least 5 days, but they can remain in school as long as their tests are negative. It is always at the option of the parents whether or not students get tested. So it is not going to be required that students be tested. And in the guidance, they said that vaccinated staff and students are exempt from quarantine. Janine, did you want to add anything?
No, I do want to just emphasize what you had said about the parents in terms of participation, is that consent is necessary, at least as it relates to the pool testing as well. So I think that that's really important. That came out in the guidances from last year. Again, this the current slide that you see, it does have an active link, because there's quite a bit of kind of complexity to some of these scenarios, just in terms of, again, asymptomatic, people that are vaccinated versus unvaccinated, what to do when you're on the school bus, distancing, et cetera. But we wanted to at least provide you with some highlights here. And again, it's part of this new test, and many of these new procedures really were to try to allow the students that are able to remain in school, so that their participation in sports, extracurriculars, and just general being in school academically was not as interrupted as it was before.
Yeah, because I mean, we know for all students, and perhaps even more for special needs students, that our kids need to be in school if they possibly can, safely. So it's a real fine line that we're walking there.
Ladies, we have 2 questions. Someone asked, does a town or city's mandate trump the state's? Because someone else mentioned that Andover has implemented a mask mandate.
Yeah, the governor is allowing things to be, the decisions to be made at the local level. So the governor currently is sticking by a no mandate, but allowing the localities to decide. And so it sounds like Andover maybe has decided, as I said, I think Salem and maybe a few other districts are already making that decision. And that seems to be in line with what the governor has said. Yeah.
I mean, we're not Texas. We haven't banned mask mandates at the local level. So yeah, the school districts can make their own decisions about that. If the governor were to put in a statewide mask mandate, I believe we would all be required to follow it. So, okay, where's my next slide? Mary Beth, was there another question?
No, there were just several responses to that question that were written in the question and answer of different towns that have, in fact, like Worcester has a mask mandate. So things like that.
Yeah, and I think we're going to see, Eileen was saying that, several of the towns are having their town meetings, they're having their school committee meetings. So I think as we get closer to the start of school, districts are going to be starting to make, schools and districts are going to start to make these decisions. So that's why we said it's day by day, hour by hour, that some of these developments are happening.
And it's also important to note that even when there is a mask mandate in place, our children who can't wear a mask for health or behavioral reasons will not be forced to wear one. And also that because parents have consent for doing testing, if we have kids who can't handle having a swab up their nose, they're also not going to be required to do that. which brings us to health and medical conditions.
Yeah, so, right, it all weaves into each other. So the home hospital services, they have been around for quite a while. Some of you all on this call maybe have utilized it before. What's new this time around, as Eileen had said, the question and answer guide, which again, we've also have links to right here on this page. The question and answer guide is new, it's updated. And I think they've updated both of the forms, but the prior form was really just if your student was out 14 days and more. And now the first form is, and these are these physician affirmation forms. The first one is for when a student is going to be out 14 days, but less than 60. And now the new form is if your student is going to be out for more than 60 days. So this is the new clarification. What's really being emphasized, and we'll talk about this in just a minute, is that for students that need to be out more than 60 days, that there's really an emphasis on districts needing to hold a meeting to talk about the students who will be out. And again, as I said, there's the use of the new forms. So with the 14-day form, which you see here, I do want to also note, because this is important if people haven't experienced this before, there had been some issues in the past, but the person who's able to fill out the form, it is a physician's affirmation, but it can be a nurse practitioner, or it could be a psychiatrist or a specialist that's seeing your child. That's all described in the Q&A, just so people understand that, because that's been an issue in the past and that's now been clarified. Again, anyone that's out, the form needs to be filled out. It needs to be presented to the principal, and then without undue delay, and once they've considered everything, taking into the needs of the student in their educational programming, they need to coordinate the services. The services that are for the 14 days, this can be for regular ed or special ed. It's not just for special ed, but if educational services are special ed, again, they need to be including also services in the student's IEP. Also, what's important to note here is that, and we'll talk about this also later, that we know that sometimes students are home that are immunocompromised, and a sibling may also need to be home and not to be able to attend school because they wouldn't want to be, going out and then bringing in, any germs into the home. So there are some exceptions that they're making for some siblings as well. And again, with proper documentation and going through the proper channels, but that's something else that's important. And again, as I was saying before, that with the 60-day notice, it's, looking to convene a team meeting without undue delay to consider or amend a student's existing IEP or develop a new IEP, and any changes that need to happen to the IEP should happen within 10 school days of receiving this note from a medical provider. I don't know if you want to add to any of that, Eileen?
No, thanks. I think that covers it well.
I do have a question regarding a mandate again, regarding the social distance mandate. Is that still in place? One individual discusses that she has a son with a disability who has a doctor's note, which says that he doesn't have to wear his mask if he can social distance for 6 feet, but and he's also had his 2 shots, but he has an aide with him, which makes it more complicated because the aide has to be close by. So anything you can address as far as that is concerned?
In the new guidance, and correct me, Eileen, and I would need to take a look at that maybe when we move along with this, but I'm not sure if the 6 feet was being required. I know some of the guidance was talking about 3 feet. And I think that was in place before in a lot of districts. So I don't know in terms of the person that asked the question, whether the 6 feet was something that was being implemented in this past school year at all for the student, or if this is something new. I'm sorry, Eileen, you were going to say.
Well, I was going to say that last year's guidance did go to 3 feet between students, assuming that they were masked. It may be that he had a 6 foot guidance because he was not able to be masked. I would personally want to know if the aides were vaccinated. That would be important information, if possible, to get. But I think that when the governor lifted essentially the rules from last year, as far as I know, the distance requirements are not currently in place. But it's, I think, going to be common sense to try to keep the desks as far apart as possible. The problem is, if all the students go back at once, distancing may not be physically possible, depending on the size of the classroom, the number of students in the class. And we have a regulation with the force of law that all students will be going back 5 days a week. So that may be why that hasn't been explicitly addressed.
Thank
Does that
you.
make sense to you, Janine?
Yeah, and again, I was just trying to quickly look again, because in some of the newer scenarios that just came out, I believe it may have been related to buses that they were talking about the distancing requirement. But I will take a look if I can during our presentation, and if not, I think what's also important, which we'll probably reiterate at the end too, is that if we're not able to get to your question, both the Federation and the MAC have our helplines, our lines in which people can call in to ask questions. We certainly get questions, thousands of callers that call each of our centers each year with questions. So if you did not get your question answered, or perhaps we can make sure that we get that explicitly addressed. If there's an addendum that we can maybe do after this presentation when we send it out, we'll make sure to just get that clarified.
Yes, and very often with our Federation webinars, we answer questions in a separate document for those who haven't had time to get their questions done. We're not going to do that this time, just because the information is changing so rapidly that we don't want to give you an answer that somebody could look at a week later and it's out of date. So we're going to ask that people call into our helplines. Are you ready for the next page?
Yep.
Okay.
So just a little bit more again on the home hospital. Again, the intent of this regulation is really to provide students that receive publicly funded education to make educational progress, even when a physician determines that they're physically unable to attend school. It's, while we realize it's not possible to completely replicate the total school experience, a school district must provide at minimum instruction necessary to enable the student to keep up with his or her course of study and to minimize the educational loss that might occur during the period that they're either at home or in a hospital. Again, the Q&A itself goes into things a little bit in more detail, to that the school district should determine the number of instructional hours per day or per week based on the educational and medical needs of the student. It must be an individualized decision, and the amount of instructional time may be guided by an instructional approach used in a one-to-one setting as compared to an approach used in school. Also, the time of day in which the student receives services really needs to be based on the best interests of the student. We've learned so much Again, having gone through this last March and a lot of last year where students were home and learning remotely. So there are already a lot of systems in place that are set up that can accommodate in terms of this live streaming or remote learning. And again, the guidance itself really goes into more detail, but some of the features that were in place again last year are certainly equally as important this year in terms of daily live check-ins with the teacher to support the students and their family. Much of this is just really helpful in terms of keeping track of student engagement and student well-being. So in a sense, even though, you know, we'd all rather be having students at school and having this in the rearview mirror, we still have a lot of the systems that are in place in case we need to either quickly shift or for students, again, that are going to require being at the home or hospital with the proper forms in place. There is at least a system in place to, I think, make this go about as smoothly as it can.
Okay.
So.
And I did just check as you were speaking, Janine, on the July 30th reopening guidance, and there is no mention of social distancing. They do mention they are very much encouraging vaccination clinics in schools and trying to get as many students vaccinated who are able to get vaccinated as possible.
Okay, that's right. And that the governor was stressing that yesterday as well. We wanted to talk a little bit about COVID compensatory services because those are also addressed in some of the recent guidance that has come out. We just wanted to give a brief reminder for those of you on the call, because unfortunately for some people, this may be a new term. We certainly have found with calls that have come into our helpline that people have been unaware of these services, but COVID compensatory services are those services that address a student's loss of skills or knowledge or lack of progress during COVID-19 because IEP services were either not provided or because the student could not access IEP services. The services are provided in addition to services in your child's current IEP. They're based on information provided by the parents, the schools, and others. And the school must decide with the parent or with the educational decision maker, whether your child needs COVID compensatory services, the specific type, amount, and duration of the services based on your child's needs. So again, it's an individualized determination, needs to be done with your team, and again, students can either receive services through general education supports, extra makeup IEP services, or new services if there's a new area of disability. You know, many students have, you know, anxiety has been exacerbated or other mental health conditions. Maybe we'll go to the next slide unless you had something to add on that, Eileen.
Well, I just wanted to say, I think it's important to emphasize that the COVID compensatory services are not just for regression. We tend to think about when we're doing extended school year decisions and things like that, districts tend to focus on regression, but this is failure to meet IEP goals or make progress toward their IEP goals, as well as regression, which of course a lot of our kids have experienced. So
oh, that's very important. Thank you for that. So again, you know, certainly DESE has stated that all students are entitled to FAPE for the last school year, regardless of the instructional model that was used, whether it was remote or hybrid or some sort of a combination. And their previous guidance that they put out on this topic, again, it's been updated this fall, but the previous guidance was really to address any disruption or delay in instruction or services. The initial time period was during the spring and summer of 2020. So from March to June. However, when students were returning and IEPs, again, there were some issues still with full implementation of some students' IEPs or other extenuating circumstances that arose during the 2021 school year that impacted the students' abilities to access FAPE. Their teams needed to, again, be meeting to discuss this. What the new guidance has said is that for this fall, in the event that your IEP team has not convened to address your students' individual need for compensatory services consistent with the DESE guidance, that the district should convene the IEP team meeting as soon as possible during the 2021-2022 school year, so starting this fall, and then to make an individualized determination of need. So we expect as students transition back into school, we're going to start to see this happening. Again, this has been stressed in the recent guidance. And certainly if this is not happening, and we do provide information on the last page, certainly parents and guardians have the right to request the meetings or to pursue their due process rights through either the department's problem resolution system or through the Bureau of Special Education Appeals. And we provide links on the last page for resources.
And it's important to think about too, that maybe if students haven't had evaluations to really understand where they are in terms of their learning, that they may need to have new evaluations. And it seems reasonable to expect that a lot of people will want them as we go back to school. So there's going to be potentially somewhat of a bottleneck for these meetings, but they need to be addressed just as soon as possible.
Yeah. And the timelines for evaluations are, where they always were before COVID. So they are in place. But as Eileen said, I think that, things may require a bit of patience, because I think there might be quite a few people asking for either updated evals or these things as we get into the school year. Again, just going back to the students and when districts should convene the meetings for students who's impacted. Students that are likely most in need of the COVID compensatory services. We're actually on the next slide, Eileen. So in case your student falls into this category, either students with disabilities in districts that were fully remote for 3 months or more during the 2020-21 school year, students with disabilities that were chronically absent during the 2020-2021 school year, and all students with disabilities who had significant difficulty accessing remote learning due to the nature or severity of the child's disability, any technology barriers, any language access barriers, or other barriers that resulted from the pandemic. It's just important to kind of keep these factors in mind when thinking about it as it relates to your child, as to when it would be appropriate to maybe call the team. Is that if any of these things are applicable to your situation, and if you have not had a meeting, we would highly recommend, and certainly the state has suggested it.
And I would say too, especially for special education surrogate parents whose students are in congregate care settings such as group homes, we know that a lot of our kids experience tremendous technology barriers and supervision barriers in the group homes, and we're really not able to access FAPE. So if your student has not yet had a meeting to discuss COVID compensatory services, it would be a very high priority to get that.
And these discussions about COVID services and any related issues stemming from the past school year, they can occur at the annual team meeting. They can occur during a meeting that's scheduled specifically to discuss COVID compensatory or any other team meeting. So
And they could occur at the meeting following new evaluations if you request.
Exactly.
Okay.
Another new guidance. So I said there's a lot of things that have come out this summer and we're still expecting more to come. This is very important. This is the student engagement, learning, well-being, and safety guidance by the department. There's some really very exciting things I think that are included in this guidance. The department has really recognized just the impact that many students and their families have experienced during this time. And so there's a lot of sensitivity to that in this guidance itself. It's really focused, having kind of a focused and a phased in approach to supporting students as they return in the fall. It's really looking to engage families as partners, trying to work with them to figure out what are the best ways to communicate, the best methods of communication, what is the primary language. So for example, it's referenced in this document and it was referenced in past guidances, but there are communication plans that the department has given links to school districts to look at, which asks many of these basic questions. We know not all families either have, I don't even know if many families do have a home landline to reach them at, whether email sometimes is the best option because a lot of people are working very long hours, so sometimes texting is better. And then there's all sorts of other apps, things like WhatsApp, and don't ask me to quote any more than that, but I do know that there's plenty of other technology and ways in which families communicate, and it's easier for them to communicate, and then certainly within their primary language, that many of these communication plans I think will be really helpful as students go back in. The department has really stressed about maintaining consistent, ongoing two-way communications with families and using culturally and linguistic responsive practices. The importance also of connecting families with resources and focusing on relationship building with students and between students and staff, and also with the families. And really looking to the families to gather input. We all know, again, and that's why the importance, as we were saying on the piece with the COVID compensatory services, it isn't just a regression model. It's going to be, they need to hear from you all what your child may have experienced while they were at home. So gathering the input from the families is key. Another key aspect to this guidance is that exclusionary discipline is seen as a measure of last resort. The guidance talks about alternatives to suspension, and that districts only as appropriate after considering underlying reasons for the student behavior and making efforts to address the student needs should there be any exclusionary discipline. So it's really, again, kind of a real focused and more targeted approach, really making social, emotional, and student well-being care kind of a visible part of the school for staff, for students, for the families. Also, again, you all may have heard of the kind of the tiered system of supports, where tier 1 is aimed at all students, tier 2 is more individualized and tailored to a student's needs, and tier 3 are more intensive services. So districts and schools, as students return, are really kind of enhancing those systems and using them, getting professional development for the teachers and staff to know how to be able to make sure that they're aware of and able to respond to any increased signs of mental health needs for students. Again, in the guidance, there's a new section that talks about universal mental health screeners, questionnaires administered to all students that are designed to identify mental health needs such as anxiety and depression, And I think for one of the first times in DESE guidance, there are sections in, it's broken down into several sections, this guidance is, but there are specific questions that are equity related questions, which is very exciting. I know not only at MAC, but certainly at the Federation, you know, the families that call us and come to us are just, you know, it's across the board, multi-language, multicultural. We have many, many families that we represent, and it's nice to see this kind of equity perspective that is being taken into account.
Yeah, because we have so many different practices across the state, because our education system is so locally organized, that it's really great to see the state putting in a guidance that is reflective of that across the board.
And as we said before, just the last page, and again with the hyperlink, so it will take you directly to our resources. We give you both the information center at the Federation and their three main numbers for the main office or Western Mass office, and then statewide. We have the number for Max Helpline, and as well as a link for services, and it also has our resources, and we have our COVID-19 resources. As we mentioned earlier, we have the phone number available for the state problem resolution system, their phone number, their email, and then both of these hyperlinks for the BSEA and PRS take you directly to the pages if you find that you need to file a complaint. I think the nice thing about PRS, if you all haven't seen on their system, or just something to know if you have to utilize it, is that when you go to their webpage, they do have a way to be able to look up your local area liaison. So there is somebody at PRS that is specifically focused on individual areas across the state. So you'll have somebody who you can speak to that is directly connected to whatever town or city that you live in. And that's available on their website.
And you can ask them a question without filing a complaint. There are attorneys who are assigned to each area and school, and there's also always an attorney of the day who can answer questions. So, I mean, I often call PRS for information. It's a very good resource. And we also really want to encourage you to call us at our information center or helpline, or to email. If things come up that seem unusual to you, if you are, for example, being asked to waive rights with your IEP, or something just seems questionable, even if you just have a concern you want to talk about, we really encourage you to call us, and we will walk you through your legal rights and strategies to try to straighten things out. Okay. Before we open up to questions, I just wanted to, because people may start to drop off a little, I wanted to just first of all say thank you to everyone for joining us today, and tell you about two upcoming events that we have new webinars for. On September the 1st, we're going to have a webinar in the evening at 5 p.m. with Janine Solomon again, and with attorney Tim Sindelar, talking about lack of progress and compensatory services in some more detail. We are also going to have our second collaborative webinar between the Federation and MAC on Tuesday, September 22nd at 12:30. And more information about all of that will be available at the Federation's website. So shall we open it up to questions, Janine?
Sure.
Okay, we've got a couple, so I'm just gonna go through them as they're there. Can you post to a link on any DESE guidance that states that schools should work with families to accommodate a student who needs to stay home due to the health of another family member? I can already see districts arguing this.
Mm-hmm. Sure, I think that is actually, and we can get that for sure, but it's in one of the hyperlinks that we already provided, I believe.
On the home and hospital form page.
Yeah, exactly.
Great.
So,
Those students who become age 22 last year for school who missed transition services could be provided services beyond 22. Have there been any cases that districts have tested and planned services for these out of age students?
I think as I'm aware, I think it's somewhat on a district by district or case by case, where I know that some students and families and districts have been able to work out arrangements, but I think it again, as part of compensatory services, as we talked about, some students did miss a big chunk during between 21 and when they would have been 22 before they would have aged out. And so it's a kind of a complex area because many of these students also are transitioning into the adult services. And there's a certain structure there and so forth, and also funding mechanisms that can make it quite complicated as to when students start services or just the completion of services as it relates to compensatory education. But I am aware that districts and families have worked things out on an individual basis. I don't know if you have more to add, Eileen.
No, not really.
Great, thank you. This particular one is regarding an out-of-district placement. Our district and our son's out-of-district placement agree that he needs compensatory services, but a hang-up is who is going to pay for the aid that will be needed. Outside placement says the aid was already provided. Who's responsible for paying?
So the aid, do I understand correctly, the aid was part of the school? It was already when the student was attending the residential program, was the aid paid for?
It does not clarify.
Okay. I don't know if the caller would clarify. That's always, again, another tricky situation, because many times I have seen where somewhat differently, but somewhat similar, of where students may need a particular service and the program, kind of has a set program or structure that they're able to offer for the student, and they may not be able to offer some of these additional services. So for something like this, it sounds like it may have been provided before. So I don't know if the person is represented by legal counsel or to try to be able to, or even have their advocate, if they're in mediation, to have their advocate to try to, work out some of those differences with the district. But it gets a little bit complicated. But I think if they were providing it before, maybe there's an argument to say that they should continue to.
And this might be a great question to call Mac's helpline to give more detail and get more specific on this. Someone's asking, and I don't know that this is actually a question that either of you can answer, is additional staff being hired to provide compensatory services since the current staff is already overwhelmed? Do you know of any districts that are doing that? My understanding is that there are actually shortages of the staff themselves, a lot of retirements or teachers deciding not to come back.
Right. No, that's
Yeah,
my understanding.
my understanding is it's less of an issue about funding, because many districts have a lot of federal funding for COVID relief, as much as it is finding people to hire, because a lot of teachers are leaving the profession and specialists.
No, it's true. And I do, to what Eileen said, I mean, there is funding that is becoming available for districts. And so, some of that is yet to probably be decided how that's going to be distributed, but it certainly is related to, at least at minimum, there's, more mental health staff, either social workers or, counselors coming on board. So, I think it's probably, again, district by district.
Yeah, and if they can hire people who want to work in an in-person school setting, because a lot of mental health professionals have switched to a remote model. So it's hard.
So is there any new guidance on turning 22 and extended services in school because of, one, COVID compensatory, and or 2, no adult programming available due to lack of staffing, and or 3, nursing required to attend in-person extended COVID compensatory schooling isn't available.
Mhm.
So COVID compensatory services are not really being delivered. They're wondering when the COVID compensatory services officially end, and is it with the ending of the Massachusetts state of emergency or the beginning of the school year?
For COVID compensatory, again, I think what the department has said in terms of its guidance is that, you know, if the families have not met yet about services, because right now the expectation is that students, except those who are unable to for their health or medical reasons, go back to school right now. As we were talking through with the home hospital form, the expectation is that students are going to go back to school 5 days a week, full time. And in doing so, we're then looking back to the services from 2020, 2021. And that's what we walked through a little bit before. So that's where if you haven't had those meetings and you do need to have that discussion, you know, the recommendation is to have a team meeting in the beginning of the school year to address any issues that relate to services that are possibly needed due to the 2021 school year.
Okay, great.
I'm not familiar with other guidance related to those specific problems. And I think it's a really hard problem because I'm not sure that those situations are necessarily going to be immediately better in September. So even if students are to go back to school, do we have the nursing supports? Do we have the other things? Are adult programs open for students who are participating in vocational education programs or participating in internships and other things in the community as part of their transition plan? Are those things open? You know, we just don't really know yet.
I would say one thing to just maybe put a plug for, it'll be on MAC's website, and we would provide updates that one of our legislative priorities is a bill. The sponsors are Rep. Gentile and Senator Barrett, and it's an act to address the needs of students with disabilities turning 22 during the COVID-19 emergency. And it's really there to help address the needs of students who turn 22 during the pandemic and require compensatory education services, again, to address a regression or lack of progress due to the disruption of services during this time. And again, students who turn 22 right now, the circuit breaker funds are currently not available to districts to pay for the cost of those compensatory services. But this legislation, again, it's not passed, this is pending legislation. It really would be to seek to amend that circuit breaker statute to allow reimbursement for the costs associated with providing compensatory services. So MAC will keep people posted on our website, and we'll send out alerts, and we'll also send those through the Federation and to let you know the status of this legislation.
Great, thank you.
Yes.
Someone else also posted that DDS is saying that it's okay for post-22 students to get compensatory services and still receive services from DDS, which I think is a good add-on to that.
Yeah, no, I think that's a very helpful add-on, and that is the reality. That's what I didn't speak of when I said that, you know, school districts and families have worked out agreements, and some of that has been to work with, I've had cases myself, to work with the adult service agency to just figure out that balance between the student having kind of one foot in both worlds and how to help, you know, where the services are going to be provided and how they're going to be provided and working that out. But it can be done. It has been done. It just, it can be, you know, it's very individualized.
Great. Question regarding the medical form from the provider. Does the school have the right to speak with the medical provider when the form is submitted to the school?
That's a good question. I would think so. And I think that's been, you know, I mean, I think if there's any questions, a lot of times I've seen cases before where there's either a question or it wasn't so clear what the physician wrote. And again, on the Q&A, and I pulled this up in my notes, I could grab it, but there are a series of questions that they want the physician to answer about the student's disability, how long they're going to be out, you know, the nature of the illness or what's going on. So if a school has a question about that, I'm sure that there must be a way for them to be able to reach back out to get some of that clarification. I think it would make sense. And again, it's something that I've seen before. I don't think it's something that is automatic, that they always have to reach back, because sometimes it's rather clear, but sometimes it's not. And I've seen those forms too, where they're just minimally filled out and they really need more, you know, more information.
Okay.
And I think that the
Can I-
form,
Sorry.
add on there, I think that many people might think of the forms as being particularly related to physical illness or being immunocompromised, but they also can be filled out by a psychiatrist.
Yes.
And one thing we saw a lot of during the pandemic is kids who are unable to access their education in the forms that it was being delivered to them. You know, hopefully those kids are going to be able to go back to school in person, but if not, they, you know, should not be receiving punitive sorts of responses like filing a child requiring assistance petition and things like that, if there are options for education that they can access through the home and hospital.
So someone asked, can a doctor write in order the district to provide in-person vaccinated tutor in the home for medically compromised students? Does the district need to fulfill a medical order?
That's a good question, but I mean, I think if they're immunocompromised, then they would need to have somebody, it sounds like they need some very specific staffing requirements in order to be able to receive that. Again, just off the top of my head, in terms of what I recall from reading through the guidance or the Q&A, I'm not sure if I saw something directly related to that, but I think it would make some common sense that if that's what a child is going to need, that they would try to do their best to be able to fulfill that, because otherwise the student might not be able to get the tutoring in that way. They wouldn't be able to get the in-person. I don't know if you've seen anything different, Eileen, in terms of services that have been provided, but it seems like, you know, it would make sense. I just don't recall seeing it. I mean, there's lots of things in the form in terms of just, you know, whether a parent needs to be home and how that works out and who can be in the home, et cetera.
The very long detail.
Yeah, it's a lot of different scenarios, as with all these guidances that have come out. So that's why we said certainly anything that's not addressed here or addressed as fully as you maybe need, please feel free to call us, because it gives us a little bit more time to get some more detail from you all about your individual circumstances, more so than we can provide in the short time we have today. I think we're actually at time.
We are at time. So I would suggest that anyone else who has posted a question, many of them are very specific to their situations, to contact the helpline at MAC or to contact the information center at the Federation, because then you can give additional details and answer questions of the person you're speaking with. So thank you,
Sometimes
everyone.
we need a bit of research before we can give you a really solid answer. So calling
Absolutely.
individually can be more helpful.
So
Well,
thank you for your questions.
so much, Janine Solomon, for joining us today.
Thanks.
We really appreciate your doing this with us, and this conversation has been very helpful, I'm sure, for a lot of people. And thank you, everyone, for attending.
We're grateful. Thank you.
Okay.